Welcome to AUA Leadership in Business, an official podcast of the American Urological Association.
Welcome to the AUA Leadership in Business podcast, where urologic professionals experience the practical application of business acumen essential to successfully navigating today's rapidly changing business environment. I'm Dr. Micheal Darson, and in today's episode, we will discuss negotiating academic contracts. Joining me today for this discussion is Dr. Julie Riley. Dr. Riley is Assistant Professor and Urology Residency Program Director at the University of Arkansas for Medical Sciences. She is also the Vice Chair of the Department of Urology and Secretary of the South Central Section of the AUA. She has worked in academic urology since graduating fellowship in 2013 and negotiated several contracts during that time. Dr. Riley, welcome.
Dr. Darson, thank you so much for you having me here, as well as the AUA for putting this together. I think this is invaluable experience and knowledge to share, and I hope that I can be of benefit to our listeners.
Well, great. Let's get started. Can you tell us about academic contracts in general?
Yeah, so a little bit different than in the private sector, I think. I mean, I personally have not negotiated a private contract nor a hospital-based contract, but all of mine have been academics. Much more of this is just sort of handed to you because there have been, it is a university contract, and that is a very standard thing. There's not a whole lot of room for negotiation on that. Many times it's just simply 1 or 2 pages, very, very simple. Really just simply giving you what you're going to get and what your title will be. And that's pretty much, the start of that. So they're pretty straightforward and they're very short, I think, relative to the private sector.
And you mentioned, or it's known that these universities often have set contracts with set pay scales. Where do those numbers originate?
Yeah, I would love to understand all of what university thinking is, but, oftentimes they are based off of, national standards. Those national standards are somewhat challenging to get as somebody who's walking into that, but they should be able to answer whether they're at, a 25th percentile of academic rank, 50th percentile, 75th percentile, where that really falls in the general scheme of people that are along associate or assistant or even full professors. In terms of the set pay scales, one thing to keep in mind is that many universities are trying to be much more equal across different demographics. And so they really do want to be fairly transparent about salaries. So they don't want to have within one department that, somebody of one particular minority is making less than somebody of, say, in a different minority or in a majority area. So they do want to be fairly transparent about it. And on top of it, you can actually look up almost all academic contracts, at least the base pay, because of the Sunshine Act, that we can actually go through and look at everybody's pay. So they do want to be fairly transparent, and that's why a lot of them have set pay scales that they really aren't going to budge on those.
Can you give us some perspective on how pay may differ regionally? For instance, in Arkansas versus Irvine, California versus New York?
Yeah, they're certainly going to look at your cost of living, and they certainly will take that into consideration. But if you're a hard place to recruit to, they may have to up that pay scale. And so, I know here in Arkansas, we have a very competitive salary that we're putting out to people that are wanting to come here simply because not everybody wants to live in Arkansas. So they do have some room to try to, kind of up those pay scales. But remember, if they do go up for one person that's recruiting, they're probably going to have to go up for everybody in that department. So, but there is some, it does take into account your cost of living and what that should be like.
Okay. Good information there. Money to negotiate, salary, bonus, incentives, and RBU targets. Can you give us some perspective on that?
Yeah, so, most academic contracts are going to have a base pay, and that is going to be set on, essentially that's what you will make regardless of what is happening to your clinical practice or anything else that's going on. Then there will also be some incentive pay often will be put into that. Some academic centers will actually just simply give you pay, and that's it. There is no compensation model. It truly is just a set salary, but some will actually put in an incentive. So if you generate a certain number of either RVUs or money gained, or whatever their benchmark is, then you can get that incentive. And then many places will actually have a bonus. I will say all of the academic centers that I've been around, most of their bonuses are nowhere close to what you're going to get in a hospital-based or in a private sector. They usually are pretty small bonuses and based upon pretty high numbers of RVUs. So I think if you're banking on that bonus coming to you, you might want to rethink that, because the reality is those bonuses can be a little bit tricky. And oftentimes they're split between people. So it's not necessarily going just directly to you. So, and then I've also seen at some institutions where they have some financial issues, that they may not actually pay out that bonus, dependent upon where you sit. Sometimes if you're in a division versus if you're in a department itself, how those bonuses get allocated to that group of people. So it is important to kind of pay attention to that. I will personally give the advice that if you're banking on that bonus coming in, you might want to rethink that, particularly in this era of not really having enough money in our hospital systems.
Sounds like that's sage advice to plan conservatively.
Yeah. And then the other thing is the RVUs. RVU targets are a little bit tricky in academic centers, because you are going to, if you're teaching residents, you're teaching medical students, you are going to be a little bit slower, and you are going to have a very different payer mix than perhaps what you might choose on your own in a private sector or hospital-based employment. So I think it's really important that you understand, are those realistic RVU targets, and what is the institution actually going to do to help you to get to those targets? So it's important to get sort of a background. What is everyone else around you making in those RVUs, and particularly within your subspecialty? Because, we certainly know that the oncology who's doing, big major oncologic cases is going to have a little bit different RVUs than, say, the person who's doing FPMRS. Both are equally important to the department and getting the patients taken care of, but they certainly have a very different RVU mix. So it's important to kind of understand, what is your RVUs? How is your department going to support you if perhaps you are in a place where you maybe don't generate as much RVUs because of the subspecialty you're in, and so how will the department help you with that?
Could you give us an example of how your department handles the difference between oncology RVUs and female reconstructive RVUs?
Yeah, without getting too much into the specific details of everything, I will say I'm in a very good model right now, because we're rebuilding a department. And so we actually don't have any of these RVU bonuses or incentives at this point. We still are straight pay. So that actually kind of helps us for that. We, looking across the board, actually, though, have pretty comparable RVUs, but we don't have an FPMRS person. So I do think that when you get into a little bit more of some of the benign diseases, that the RVUs can be a little bit skewed in that regard. We know that we're going to go into a compensation plan soon, and that is one of the reasons why we've held back, is because we want to make sure that it really is truly fair and equitable. And that we do believe once we go into that we would make a pool and kind of disperse it out, as opposed to giving it directly to the person.
Okay. And you touched on something a little earlier that I think is very important for our listeners to understand. Can you touch on the difference between the bonus structure for a department versus a division? Because folks that aren't particularly savvy with academics probably don't know how important that difference is.
Yeah, it's a great point. So wherever you're going into academics, it's important to understand, are you going into a division of urology, or are you going into a department of urology? And if you're in a department, are you big enough that you actually have divisions, and how are they represented? So, my first job out, I was in a division of urology. So we were part of the Department of Surgery. And so it was contingent upon what the department chair, who was a general surgeon, felt about the disbursement of bonuses, and how those contracts were written. where I am now, we are a department of urology. And so we have a lot more influence on contracts and say in how our payment model is structured, as well as where that money goes. We have a lot more control over it, and it's really geared specifically to urology specifically. So I think, it is important to recognize that there is a difference. It's not necessarily good or bad that one is better than the other, because there are advantages of being in a division of urology. There are certainly advantages of being in a department of urology.
Well, thanks for clarifying that. I think that's a really important point. So time is a big factor in compensation. How does your department handle how you get paid for the time commitment?
Yeah, so one of the things about academic contracts, right? They hand you a piece of paper. All of mine have been literally like one page. I mean, that's it. It's very straightforward, very simple. But where you can really get your negotiation in is your time. So how much are you expected to produce? If you are at a full 1 FTE, so your full-time equivalent, that is essentially you are doing urologic clinical care 5 days a week, all of the hours of the day. So if you're at 1 FTE, they're going to make your RVU level set off of what a urologist should be doing for 5 days a week for that entire day. However, a lot of academic centers, you're going to have some of your time paid for to do some administrative things. For instance, a urology residency program director gets a 0.2 FTE. That is written into our RRC, and the institutions have to basically pay for, like the School of Medicine pays for my time, and they pay me for a day. They pay the department. So in my salary, I have 0.2 dedicated to that. And that's something that you can really negotiate in your contracts, is what kind of time compensation am I going to be given to be doing some of the academic endeavors that the department wants me to do? Is it, training? Is it teaching? Is it research? Is it program development? Is it administrative roles within the hospital or the School of Medicine? But all of those things, you should really work on the compensation for that, because it's going to lower your RVU target and really kind of allows you to look a little bit more productive at your institution whenever you're going and asking for promotions and raises and things like that. So that's a really, really important piece to understand, is that you want to nail down what your time commitment is and what the institution or the School of Medicine is willing to pay you to come and do for that institution. And I think that that's a really big difference between what you're going to do in the private sector, where, really that's kind of lumped all together. Whereas for me, sitting in academics, it's a really big deal to understand what is my time commitment to each thing. And then, of course, you have to also set your boundaries up, because there's plenty of urology to go around. I assure you that time will be sucked up faster than you can believe. So you really do want to set your boundaries and say, no, I really do have to have this certain amount of time built into my schedule to be doing the academic mission that I was hired to do.
And I think that's also an incredibly important point, because, the time commitment, it's such an essential part of burnout these days, is overextending yourself from a commitment level. You're going to conferences at night or in the morning. And I think it's really important. Your point is really important, to understand what you're going to get paid for, and equally important to set limits and understand that for longevity purposes.
I agree 100%. And I think it's important to remind the institution that you're hired at, kind of regardless of whatever you go into, that what your value is and what you brought to the table, to make sure that you're being honored in that regard. I just think that's important across the board, to help with just life in general.
Yeah, good advice all around, for sure. All right, let's talk about promotion in academic settings.
Yeah, so I think that this is a key thing that I really didn't quite understand whenever I first started. I certainly understood that you were going to go from an assistant to an associate to a full professor. But what I did not understand was how that exactly worked and what it actually meant to get promoted. So I kind of naively was like, yeah, if I do the work and I put in the time and effort, they just promote me after, the set criteria, right? Is it 5? Is it 7? Whatever your institution lays out. But it turns out you're going to put together a very complicated dossier during all of your very, very busy clinical practice, right as soon as you have really built up steam, right? So you have left kind of that very initial, junior faculty, and you've hit that 5 to 7 year mark, and now you're going to take several months to prepare a dossier. And I very naively did not really appreciate how complicated that was. But luckily, someone very smart and a very good advice that was given to me about 2 years into my career said, start preparing your dossier right now. And it will make it so much easier. So I will give this advice to anybody that's going into academics. Start your dossier preparation on day 1. Whatever day that is that you start, go ahead and write it down. Write down literally every single thing that you do. Like if you hold a door open for somebody, like I swear to God, that might go in your dossier. That might be a little extreme, but really, truly write down every medical student lecture that you give, every, person that you mentor, because all of those things add up, and you're going to forget about what you did, 3.5 years ago, because you just simply did not write that down. And it's more than your CV. Your CV, you're not going to put in that, you mentored one student for an hour. Like, you're not going to put that in your CV, but you are going to put that into your dossier. So I think it's really important in your negotiations to talk to somebody in the P&T committee, the promotion and tenure committee, to understand what are the rules for getting promoted. And also, what are the benefits of being on a tenure track? Because there are multiple tracks in academics. Are you going to be on the clinical side? Are you going to be on a tenured track? And what does your institution actually have? And is there a benefit of being a tenured track person? 10 years ago, that probably was beneficial, and there was some clout behind being a tenured professor. But I'm not sure that most people in academics are really as concerned about that anymore. And so if your institution, the only advantage of being tenured is that you get to say it, you may want to think about maybe not going down that route, because many institutions, if you do not make the promotion, they will ask you to leave. And I personally haven't seen that happen, but I have seen people avoid going up to their promotion because they are afraid that they're not going to make it. And so I think it's important that you do recognize that, and you talk to people within your institution about what is the advantage of the different tracks and how do you get to them. And then also, what happens if you don't get promoted or you don't make those requirements in a certain set time frame.
It's interesting that I've spent most of my career in private practice, but I started out in kind of a quasi-academic setting, and I still have many friends in academics. And it's interesting that it seems like over time, the university is viewing what doctors do comprehensively much better, and much more accepting of things that don't necessarily click as a research project or a publication. And so that's really, I think, been an important progression for university and academic settings.
I agree 100%. And I am very thankful that they have not really made everybody go into being the clinician scientist. I mean, it'd be great if we could do that, but the reality is we're so short on doctors. We need them practicing medicine. And I think that we should really reward those people in academics that are doing really good clinical care and really good education. And now a lot of institutions have that model to do that. So I'm glad you brought that up, because it is really nice that has been recognized.
Well, I think that's potentially a reason that people don't fully consider academics, is because they have more of that concept of, I've got to spend 40% of my time in a research lab doing mass spec or whatever, so it's been a really cool progression for me to see that from a private practice sector. So yeah. Can you talk or touch base on the difference between a dossier and a CV? Because I think that's an important distinction.
Yes. So your CV is, really going to be what you would put out if you were looking for a job. If you are, going to go up for a leadership position in the AUA, or, kind of just telling people what your position is. Your publications are on there, maybe some, presentations that you've done at national meetings or regional meetings, committee work, things like that. Your dossier is really looking at really much more specific about what kind of your views are and your mission statement, so to speak. So most of the time, most institutions are going to require, depending on exactly what your tract is and how you're doing it. If you're focused more on education, then you're going to have to make sure in your dossier that you have an educational statement, and then it's going to show everything that you've done in the educational sector. And you're going to basically write up a mission statement of what your viewpoint is on education and why that fits into the institution. You would need to do that in the research sector, in education, in your clinical practice, or administrative things, depending again on your mix and what your P&T committee would require on that. And these dossiers can be hundreds of pages. Even if you send out a 100-page CV, no one's made it past page 2. But your dossier for sure is going to have just an unbelievable amount of information in it, and very specific dates. Exactly what you had to do in each of those educational roles that you did, or your clinical practice. I know at one of my institutions for promotion, you had to start a new clinical process of some sort, like some sort of clinical endeavor, and you had to demonstrate what you did. And so I had to I had started an acute stone clinic. And so I really went through the whole process of how I had to work through that and all the people I had to collaborate with, and then the end result of what I got. Now that's nowhere on my CV. It truly is something that really went into paragraph description in a dossier.
Is it fair to say that you can look at your dossier as your own personal journal, and what you're adding to the institution?
That is a very nice way to look at it. I will say that the institution will have a certain templates for them, so it may not be exactly as free as your journal would be. Mm-hmm. But I think it's a fair assessment to say that it has a lot more personal touch to it, and really what you bring to that institution, and really bragging about what you've managed to accomplish during that time frame that you've been at that academic institution. But each one will have its own template, so you do have to make sure that you follow that, and it may not feel quite as true to you whenever you're doing it, but certainly I think the first rough drafts of it will be very true to you, and then you have to put it into that template.
I have a few colleague friends that they keep it on their desktop and update it certainly weekly and sometimes daily. So
yes, after I get home from every meeting, I go and I update it. After every grand rounds lecture I give, that's my time, right? Like I have it queued into my list to make sure that I update both my CV if that's necessary, but certainly going into my dossier. And I keep track every 6 months. I have I have sort of my faculty. It's basically my template of what I've done in those last 6 months. And every year during my faculty review, I just pull those last 2 6-month periods out, and I say, here's what I've done. And it's significantly easier for both my chair and myself to be able to look through that and say, okay, that's what we've done. We can go brag about ourselves to the dean or whatever it is we have to do. But, the reality is there is a lot of sort of this facade to make sure that your department is really delivering to the institution.
Sounds like there's room there to develop an app for that.
Ooh, very smart. Someone who is young out there who's listening to this, let's do it.
Right, exactly. Let's talk about titles.
Yeah. So, in the academic world, everybody is going to have a title. And so it's important to understand, though, what does actually come with that title. You might be, certainly your first title is whether you're an assistant or an associate or a full professor. That's going to be kind of your first title. But then are you directing something? So are you the director of urologic oncology? Are you the director of, urologic research or something like that? And you have to understand, what does that come with? Does it come with time? Does it come with money? Or is it just simply a feather in your cap and something you can put into your dossier to, go forward with promotion? Because not everything is going to come necessarily with time or money. And so some of it may be just for your future self to make sure that you have shown that you have leadership and that you've developed some things within your department. But if you're going to be something for the institution, so, if you're going to be the quality champion or the quality chair, that's a good time to kind of pull back out your contract and make sure that you have negotiated in, do you have time? Do you have money? Do you have the resources to do what it is that they're asking you to do? If the institution is coming to you and asking you to do some of their, I hate to say it like this, but some of their work, you want to make sure that you get something back in return for that, because they certainly would love it if you said that you would do that for free. So they will more than happily accept that. But I think it's important that we understand our worth and we say, well, wait a second, we're doing a job for you. What can we get? How do we negotiate that? And so that is an important time to pull back out your contract and make sure, do you have the right time ratio? Do you have the right financial incentives? Do you have the right resources to do those things? But those are certainly titles that, the institution really likes to see, because when it comes time to be promoted and they see that you have engaged in the institution, in the mission, they're certainly going to appreciate that a whole lot more. And so I think it's important to really take on some of those roles, but do make sure that you get the right things in return.
Can you touch a little bit on the language of the titles? When you see somebody and they're introduced, what is some of that jargon? What should that mean to people that are listening?
Yeah, I will say that I have had a few made up titles in my lifetime. So I will fess up very, very quickly that I have been involved where I've been doing something that is a little bit unique that the department or the institution would like to make credit of. But it's really not something that has ever really existed before at that. I'm actually a transplant surgeon as well. And I was really, really taking a lot of energy making the listing committee in a lot better shape for the surgeons and really kind of taking hold of that. And so one of the things that my title became was the lead transplant surgeon. That was not a title that was ever there before. I'm not even sure what that means, but it was a title. And again, that helped when it came time for promotion. Now, there are some other things that really do mean something. So, a vice chair, there are departments that are big enough that are going to have multiple vice chairs. Is it vice chair of faculty affairs, vice chair of promotions? There's a lot of different vice chairs that are out there. That's going to be sort of the right-hand man to the chair, and that they're going to have a area where they're really developing that particular aspect. I currently serve as the vice chair. We are not big enough to have multiple vice chairs, so I'm basically kind of the second in command to make sure that everybody at the institution is aware of, kind of the hierarchy of the department, and really try to help my chair to have, good decisions and kind of be the voice of the faculty to my chair and vice versa. So I think some of those now, in bigger departments, they're going to, possibly have like a vice chair of research or a director of research. And certainly that's somebody who's going to be organizing a lot of the different research endeavors among either the residents, the medical students, the faculty, across specialties. So, and then, there are things like the director of, the clinic spaces or the ORs, things like that. And so some of them are pretty obvious what those are saying, but, what does that exactly mean in terms of like, is one particular title better than another? I don't think so. I think that they all serve their role, and as long as you have a very clear role. So, I think the difference between like, oh, I'm a vice chair here versus I'm a vice chair, I don't think that makes any difference in the grand scheme of things.
And you mentioned the different levels at which people come in: assistant, associate, full tenure. Can you talk a little bit about what that means and the timeline behind that?
Yeah. So the assistant professor is going to be, well, I should take that back. There are some institutions that you actually come in as an instructor. And so that is, a little bit institution based, but most institutions you're going to come in as an assistant professor, and that essentially just means an entry level position. You're straight out of residency, straight out of fellowship, straight out of training, and most institutions you have to be there 5 to 7 years before you can go up for promotion, and you can ask to be promoted up by your chair. Your chair has to give you permission to do it. So you don't just automatically, after 5 years, if your institution says it's 5 years, you don't automatically do that. You have to have your chair's approval to do it. And you would then make a request to the promotions and tenure committee, the P&T committee, and say, I would like to go up for promotion. They will then help you prepare all of this dossier, and your chair will help you too. You'll need lots of letters of recommendation, either within your institution or outside of your institution, again, depending upon your rules. And then you would go up to an associate professor. The associate professor is sort of like your mid-career person. And so they're going to be looked more towards mentorship as they're, moving forward with things. They're going to be looking more towards some of the entry-level leadership positions. Really, these are people who have a pretty firm grasp of their clinical endeavors, but now they're starting to move into a little bit more furthering their academic side, be it administratively, research-wise, or, again, with mentoring and teaching. And then, again, after their 5 to 7 years, depending on the institution, then you can apply to become a professor. And again, it's the same protocol. You're going to have to go through your chair. Your chair has to give you the recommendation that it's time to go up for promotion. You're talking to the P&T committee, and they're going to walk you through what you need. To become a full professor, you're going to need a lot more robust dossier, and you're going to also need a lot more robust letters of recommendation. Many institutions will require those letters to come from outside of your institution, so not people you work with every day, that are full professors at another institution that you never worked with. So they're going to just basically write you a letter based upon your reputation in the field of urology. So that can be a little bit intimidating, that these are not your friends. These are not necessarily, the people that, you know what they're going to say in that letter. These are going to be people that you're dependent upon what your national reputation truly is.
That's a fascinating point, actually.
Yeah.
Let's talk a little bit about research.
Yes. So I will be the first one to say that my research endeavors in academics have not been the highlight of my career. But I will say, for people that are very interested in research and going into academics, that is a really important thing to make sure that you have your protected time that you need. So it is incredibly important that you negotiate in that research time, as well as making sure that you have support staff. Do you need a statistician? Where are you going to get statistics from? Do you need somebody to help you with IRBs and getting through that process? Do you need somebody who is actually enrolling patients and getting consent, data collection, things like that? And so you have to understand, what does the institution have for you, and how are you putting that into your contract? I have seen people with research coordinators within the department, within a division, or solely to one person, because they have been sort of the driver of research. I have also seen people that they really did need a research coordinator and they didn't get it. And that really stunted their development and their progress on research. So I think it's very, very important that ask for what you need and really see what the institution can do. They might get very creative, and that's okay. Allow them to be creative, because they may have somebody who's in another department, that faculty member has left. They need to sit it in that department, but they kind of want to have you use them. Like, whatever creativity they come up with, that's great. But it's important to make sure that you have some protections in that, because it really can really affect your progression in your career if you're building a career on research.
Okay. Good points. What are other things that you can negotiate?
Yeah. So again, creativity here is key. I mean, you may not be able to negotiate your base salary, right? You might get a little bit of your incentives that you can negotiate. Your bonuses, you might really be able to get in there. But in the grand scheme of things, that isn't very much money. I mean, really, truly, because your base salary is probably not negotiable or very minimally negotiable. But things that you can really think about is, what about your time to be able to go to conferences, and which conferences are you going to go to? In an academic career, part of it is getting out, being recognized nationally for what you do. And so you want to make sure that you're able to get that time off, that you're able to have support from your chair to actually go on these endeavors. And are they actually going to pay for you to go there? And so you can negotiate some of your, basically your CME credit, but that's going to be used for your travel funds. I certainly think that if you're in a subspecialty, if you're, an FPMRS person, write it into your contract that you want to go to SUFU every year, and that's protected time for you, or whatever meeting it is that is really important to you, because that's how you're going to get much better at your speaking skills, at your presentations, at your collaboration, at your research. And again, when it's time to go up for promotion to professor, that's how you're going to be known nationally within the field, to have those people to depend on. So I think that that's a big piece to negotiate and make sure that you've thought about in your contracts. Equipment is another thing. Most of our institutions, like most of our subspecialists, have really subspecialized instruments that they need. So go ahead and ask for those things. It is much easier for an institution to negotiate in on equipment and time and these ancillary things than it is for them to negotiate your salary, because again, they have this equal playing field that they'd like to keep people on, which is good. We should, but some of the things that we need in terms of equipment might be the way that you can negotiate in. OR time, right? Like that is like, at my institution, OR time is like worth it. I mean, it's worth its weight in gold. I mean, it's huge. And if you don't have OR time, you can't do OR cases and you can't really further your career. So I think it's important to understand how your department divvies up OR time. Can you negotiate more OR time? And this is a great time to sit down with your potential new chair, is to say, what do we need to negotiate? Because your chair may be waiting for the new person to come on board to say, well, we need more OR time, we need more equipment. And so they want to kind of get you in on this bargaining deal. And that same is true for support staff, whether you need an APP, an MA, a nurse, an administrator, anything like that. This is your time, because you're probably never going to have that opportunity again once you come into the institution to be asking for some of those things. And then, of course, your space. Do you have an office? Do you have clinic space? What does it look like? Is this the moment that we need to negotiate a little bit newer types of things or bigger spaces to make sure that you're taken care of? So I think you can be incredibly creative as you go through this, and whatever you need, start asking for it. I know if you don't ask for it, you will not get it.
Mm-hmm. I know that in private practice, and this is not true of every setting, but a hospital system wants to see you come in and see you start doing cases, and you have to be kind of flexible about when you're going to do them. And then they want to see what kind of volume that you can generate, and then you can get your block time. Is that dissimilar to academics?
No, I think that's 100% true. But I mean, the hospitals certainly want to do that, but I will say everybody is trying to clamor for more OR time, and you're up against, the colorectal surgeons, the neurosurgeons. It's a much bigger pie that we're sort of dividing up. And so you might be able to negotiate your way into it. They might tell you, sorry, that's just not how it works. But this is a great opportunity to figure out, how does it work and what does it take to get additional OR time? So, sometimes you can negotiate it in, sometimes you can't. But I would say I would be a little cautious of going in and saying that you're going to prove it to them that you can earn that OR time, because most academic centers don't have the OR time to give.
Okay. Well, those are important points for sure. And you've touched a little bit on my next question, but can you kind of tell us the structure, like who's your boss in academics?
That's $1 million question. Anybody in academics is probably chuckling right now at that, because I think we do have a lot of bosses in the academic structure, and it is really, truly important to understand Who is hiring you? Are you a School of Medicine employee who is being rented out to the hospital? Are you a hospital employee? Or do you even have something completely separate and you're a medical group who is in fact rented out to the School of Medicine and the hospital? And so you have to understand who is actually really in charge of the physician side of things. And I have been in an environment where I was in a medical group and in an environment where I was a School of Medicine employee. And so, it is a little bit different on these competing factors. If you're in a medical group, you're going to have a medical group CEO. That's ultimately your person that you're going up to. If you're in a School of Medicine, then you're looking at a dean. Right? So you have the chairs and then the dean, and then you'll probably even have some sort of chancellor or executive vice, chancellor, provost, any of those titles that would be there. And they may even oversee the undergraduate campus as well. And then you'll have a board of trustees that sits even up above that really governs the purse strings of the entire institution, including, undergraduate, other professional schools, School of Nursing, all of that. And so it is important to understand who is your leadership in terms of your School of Medicine versus a medical group. Then you have your hospital side of things. Most academic people are not employed by the hospital directly. So, the nurse manager or the CEO or the chief nursing officer or the chief medical officer, those people are not exactly your boss. They certainly affect your day-to-day practice, and you certainly want to work with them and help them, but they're not exactly your boss. And so it's important to understand that you may not have very much hiring and firing ability of your everyday clinic staff, but that's coming from a chief nursing officer or chief executive officer of your hospital. So, I think it's important to recognize that your hospital leadership structure is kind of its own entity, and the people that you work with are answering to that structure. They're not answering to your structure, which more likely than not is going through a dean in some way, shape, or form. So I hope I've made that as clear as mud on how academic hierarchy works.
No, I think that's, you did a really good job with it, and I think it's very important to understand that, because in private practice, you're kind of the captain of the ship, where you and your partners are, and you're making a lot of those decisions, which is good and bad. I mean, there's a plus to it and a minus, and understanding the structure that you're going into allows you to navigate it much better. And like you said, it's much better to work with people than, fighting every step of the way, tooth and nail. So I think that's an incredibly important point. So any other things that we should touch on that we haven't?
I don't think that I have anything else, but I will say that I absolutely love academic medicine, but I train residents, most of who go into private practice. And so I think that we all serve our role. And it's really important to understand that the hospital-based employee, the private practice group, and the academic side, we all are a very vital part of our field of urology. And I think it's really very nice that the AUA is putting this all on together to make sure that we really look at all the aspects of employment. So I really do want to take the time to say that it is really important that we have the private sector, the hospital-based sector, and a small piece of it is academic as well.
And everybody working together. That's the important part. Well, thank you, Dr. Riley, for sharing your time and expertise today.
Dr. Darson, thank you so much for having me, and I really appreciate the AUA for, again, putting on a session like this. I think it's really incredible for our, I want to say it's just for the young people, but I have listened to some of this, and I think it's also very useful to me. So I think as we move along, we can always learn more stuff about how to do the business side of medicine.
Yeah, I completely agree. And thank you to our audience for joining us on the AUA Leadership and Business Podcast.
Invest in your leadership and business skills at AUA 2023 with the new AUA Institute for Leadership and Business track. Join the Institute at the AUA annual meeting in Chicago for an opportunity to grow your leadership and business skills. The new ILB track features 7 courses offering a combined total of 16 hours of programming that will enhance your business acumen, activate your interest in business and finance, and inspire you to become a leader in your practice and the field. To accommodate the robust schedule of AUA 2023, each of the 7 live courses will be recorded for access on demand after annual meeting. Resident discounts are available. Visit auanet.org/AUA 2023 to learn more and add the ILB track to your registration.